All right, so my name is Adam Waller, and I have washed my hands. I've introduced myself to my patient, and I have a signed consent form for treatment. First of all, we're doing the head, eyes, ears, nose, and throat assessment. And so I'm going to start with the head and observe the shape and symmetry of the head. It's normal cephalic, and I'll observe the hair, the hairline, if there's any balding, if there is incision, wounds, or drainage, that kind of thing. And obviously there's nothing here, and looking very healthy. And so next I will move to to check for TMJ. So I'm going to just place my hands here, open and close. Any pain?
No.
Okay, so negative TMJ. And then we will percuss the frontal and the maxillary sinuses. So does this hurt at all?
No.
Okay, good, good. All right. And then we will move to the eyes, and we'll be looking at the cranial nerve 3, 4, and 6. And I first will just look at the shape and symmetry of the eyebrow and eyelashes. There's no drainage, there's no matting. The sclera is white, there's no scleritis, there's no jaundice. And then looking at the conjunctiva here, and everything is pink and moist, looking really good. I'm going to check for her pupils, if they're round and reactive to light. Just look straight forward for me. Very good. And they are very nice. Next, I'm going to check for the 6 cardinal fields. So just follow my finger. Keep your head still. And she did very nicely. No nystagmus noted. So then I will go ahead and look into the eye, and I'll observe for red reflex, and then also looking into the lens and the retina, and then we'll be observing the superior and inferior nasal and the superior and inferior temporal. So just look straight forward for me, and then I will observe red. There's the red reflex right there, and then I'm going to move in closer to the lens and then the retina, and then I'm observing the superior and inferior nasal and superior and inferior temporal. Go ahead and look at my light for just a second, and there's the macula. Okay, then I'm going to move over to the other side. Watching for red reflex at the very beginning. Just look straight forward, and there it is. And then I'll move in closer to the lens, and then into the retina. The inferior and superior temporal, and inferior and superior nasal. Look at my light for a second, and there's the macula. Okay, very good. Next, we'll move to the ears. Okay, I'm going to observe the ear, and just going to watch for symmetry and if there is any drainage, any redness. Do you have any hearing difficulties or problems?
No.
Okay, so would be cranial nerve 8. Okay, so then I'm going to go ahead and inspect the inside of the ear and look at the temporal membrane. Cover on. All right. And it is pearly gray, looking very nice. And then coming over to the other ear, symmetry, drainage, redness, and there's none of that. I'm going to go ahead and look at the temporal membrane. And it is pearly gray, looking nice.